Hey, this is Doc Erik. Welcome to my YouTube neighborhood, the channel where we give you one mindset tip and one body set tip to take with you not only throughout today's video, but also later in life as well. Today, what we're going to be doing is talking about repetitive sprain strains to the lower back. So let's go ahead and jump in. So most of us have had lower back pain at some point in our life. It can affect one side of the body, it can affect another side of the body. The pain can jump down into the legs, the pain can creep up into that mid-back. But if you're someone who's chronically or constantly re-injuring the same tissues over and over and over again, we would refer to that as repetitive sprain strains, in particular to the lower back. So what we want to do is we want to address why exactly is it becoming a repetitive sprain strain? Why does this issue continue to reoccur for you over and over and over again? What we want to do is to determine what is actually tugging on the lower back muscles, what's tugging on those ligaments, and what's tugging on the capsules of the lower back and the spine itself. So likely there's a reason that the hinge point of the L4 and L5 and L5S1 region are getting tugged on, causing pressure to the discs and the ligaments and the body's ability to adapt to day-to-day stressors. This dysfunction is usually due to issues that are occurring above and below the joint. It could be something, for example, it could be a thoracic rotation or extension or flexion, limited range of motion, or it could be a limitation into some of the soft tissues such as the teres minor and the lat muscle, which are these big shoulder muscles on the back. We may also find that on an evaluation, we assess this person and we check out their hip mobility, right, which is the next joint, which is below the lumbar spine itself. They may have adequate passive, meaning they're not doing anything when we take them through a range of motion. The passive range of motion is actually pretty good, but when we actually have them actively control those muscle tissues, we find that there's a lack of strength there. So typically we'll be looking at what are the glutes doing, what are the hamstrings doing, things like that. So the analogy that I like to use is if you are having some sort of a lower back dysfunction and we want to assess above, which would be into that thoracic area, as well as below, which is into that hip area. If you have a 10% loss in the thoracic spine or into the soft tissues in that area, and if you also have a 10% loss into the glutes, into the hamstrings, and to that hip complex, then now what you're doing is you're making the lower back work, making up the difference. You're making the lower back work an extra 20% harder than it normally does. And what ends up happening is you're going to start to wear out those tissues a little bit faster than you'd like. So if you're somebody who is repetitively injuring their lower back, we want to look above, which is into the thoracic spine. We want to look below, which is into the hips. And we want to see what above and below is doing, as well as to address any limitations in strength or flexibility or mobility or combination of all the above. Only then, when we have an adequate assessment, can we start to provide you with strength-based exercises to activate and to strengthen those key tissues. So the body set tip and the mindset tip is to identify, if you're someone who's chronically injuring an area, try to identify exactly what the motion is that you're doing. Is it constantly bending forward? Is it constantly twisting and rotating that's causing your pain? And if so, these are things to mention to your provider so that they can best assess and diagnose you, especially if you're doing a telehealth visit, because again, always in person is best, but we obviously know that that's not an option for everybody right now. So go ahead and get those tissues evaluated, and then also listen to the advice that your therapist give you, because that's going to ultimately help you get out of pain the fastest. So there you have it. We addressed the repetitive sprain strains and things that you want to look out for. If you have any questions, comments, or concerns, you can go ahead and drop them down in the comment section below. A lot of these videos that I generate are generated from content based from you guys at home, so I thank you for that as always. Don't forget to rate, review, subscribe, share these videos with your friends. It helps the channel grow, and it helps me pump out more good content for you guys as well. And until next time, stay healthy.